Welcome to the Registry Insider. I'm Bill Seifarth, CEO and Executive Director for the National Registry of EMTs. And in today's episode, we're going to have an update on the progress that's been made for having simulation more formally in EMS education across our country. And returning to our podcast today is Dr. Andrew Spain from the Society of Simulation in Healthcare. Did I get that right?
Yeah, Society for Simulation in Healthcare, yep.
Excellent. Well, thank you for coming back and joining us. Actually, we're filming from the National Association of EMS Educators, and when we were at this conference last year in Pittsburgh, you debuted, if you will, and gave us a little update in terms of what SSH does as it relates to simulation and how that intersects with EMS and EMS education.
Sure.
So again, thanks for coming back. And let's start by talking a little bit about how did we get into this position where we're in right now, where us, the National Registry, your organization, as well as co-AMSP, NREMT, the EMS educators, as well as NREMT and some others, came together and said, how do we get simulation more formally into EMS education? So walk us down a little bit of that story, if you will, from your perspective.
Well, and when you look at it, EMS actually has been some of the early adopters of a lot of simulation practices. You can go back even to the psychomotor testing in the early 70s, even just with task trainers. That's all simulation, be it on the IV arms, the airway heads, things like that, that not only we can learn on how to do those skills, but of course be validated onto our steps for those processes, for example. Technology certainly has come a long way that supports simulation as an educational methodology. So we not only have the full body mannequins that are programmable, and in some cases they have physiologic modeling so they respond to the care without the operator having to do anything, for an example. So technology has certainly changed what we have for simulation. We have seen so much research in the use of the standardized patients, often called simulated patients, so that helps us improve our communication skills, which we all know is so essential for high quality patient care, especially when we're talking about stopping errors. We want to be able to talk well, make ourselves heard, be accurate, be consistent when we're handing off patient care. We're all tired of probably seeing in the top 10 of the Joint Commission, let's do better at this list, where our patient handoffs don't go so well. And what do we do in EMS every single day? Hand off patients to the ER. And so that's some of the great areas for simulation that are essential for us when we're doing our EMS education activities.
So that's kind of the why simulation is so important and a value add for EMS education. So a couple years ago too, you and I had a conversation and we felt that it would be appropriate to try and get together all the key players that would be involved in EMS education.
Absolutely.
Which would be the organizations I mentioned earlier, NREMT, COA-AMSP, I believe NSEMSO, AEMT, your organization, our organization. Had a series of meetings talking about, how can we go from good to great? The joke was that, often in EMS, educators would go to an 8-hour, 16-hour weekend course and feel like they're expert in simulation. That's not quite the case, is it? So there's a need for more education, a need for more resources, and that's where your organization comes in.
Well, and I would say it's all organizations working together.
Yeah.
SSH, of course, is an interprofessional organization. Paramedics certainly, and EMT education certainly is a part of that. But we have physicians, nurses, respiratory therapists, occupational therapists, veterinarians are even part of our organization. Healthcare simulation at its core has the same fundamentals in terms of the design, the delivery, assessing performance, evaluating the programs. All those things are fundamentally the same no matter where you do simulation. And so we, of course, as joint organizations have said, hey, let's focus on EMS and what we're doing in EMS education to promote high quality simulation activities, because there's lots of ways to educate, and simulation absolutely is one of those ways, and a very, very important way. I would dare say most of our learners actually prefer simulation because it's exciting, it's hands-on, it feels like you're on the street or in somebody's home. You can replicate all of these wonderful things, and it absolutely is a bridge from the book to the street, as we have seen so many times.
And a bridge from the book to the street, I like that. I was thinking it's also helping them to build the confidence as they gain competence in the journey of learning. So very good.
Because you're tying those things all together, because it's one thing to talk about starting IVs in a book or placing the airway, But when do you do it? What does the patient presentation look like? And we can simulate so many of those things.
So this group, as I was talking about, came together and we talked about the potential, like I said, going good to great, providing more resources and working collectively and collaboratively together. We subsequently developed a white paper in terms of
joint statement. Yes.
Yeah, a joint statement. Yes. So describe for our listeners a little bit about what's contained in that joint statement and where it's going to take us going forward.
Yeah, what we have is 4 organizations have officially signed off on that, of course, being SSH, the National Registry, COA, and NREMT so far. We'll be hoping to, of course, add more of the EMS-specific organizations. But essentially says, in EMS education, simulation is an essential component of our educational arsenal. We need to make sure we do it well. And so it has some core principle items that are listed as part of that statement that outline these are the things to focus on, and make sure you're embedding them into the standards that have been developed by the simulation organizations. Obviously, SSH has developed a lot of those for accreditation standards through the certifications. You have the Code of Ethics, you have the Healthcare Simulation Dictionary, but we worked with a lot of other organizations on many of those things, and they also have standards, such as ASPE for the standardized use of standardized patients. INAXL has the INAXL standards of healthcare simulation standards of best practice. I know that in Europe we see some standards from SESAM and from ASPE, for example, as well. And all these organizations are working together. And now we have the capability to directly work with EMS-specific organizations who best understand the industry of EMS education. And we can work together to promote high-quality healthcare simulation, which leads to improved patient outcomes. That's why we're here. That's why we're all here.
Ultimately, improve patient outcomes. But preceding that, better quality education.
Absolutely.
And allowing the candidates to have that experience prior to practicing on real human beings. So phenomenal.
Absolutely, yeah. Because we need to move beyond, hey, let's just replicate the great call from last night, throw the mannequin into the mud or whatever it is that we want to do, into educational methodology surrounding the design and delivery of it. So you take those great patient presentations that may have existed, but mature it through the educational design and delivery process. Great simulation comes out of that great process, and it's much better for the students.
And also for the clinicians, because it's not only using initial education, but also for continued competence and assurance.
Absolutely.
Of that. So.
Yeah. As we evolve protocols, add new equipment in, need to improve our teamwork, whatever it may be.
Absolutely. So this position paper has been drafted and signed off by 4 organizations, my organization being one of them. What's next? Where do you envision this going for continued collaboration with your expertise in simulation and healthcare, and then the expertise of the EMS educators in assessment, and collectively we can collaborate and move forward to achieve ultimately better patient outcomes, but also better education. What's next? What's it going to look like?
I think fundamentally it has to start with listening to what EMS educators need, and actually EMS clinicians as well, as you're talking about. What is it that they need to become better practitioners of healthcare simulation, the art, science, and practice of healthcare simulation? So we already know a much broader range of educational opportunities specific to EMS education would be of great benefit. So we can start to work together to develop those things. It's very reasonable to think that we're going to identify research possibilities, priorities, actual specific research questions. We don't know what that will look like, of course, but it's very reasonable as we hear from the membership of the various organizations, and of course what you're seeing through the data that you capture at the National Registry and so on, that we'll start to see those trends, and we can identify, here's some great areas that we can all focus on, promote to the community and say, hey, we have some things to look at, to work on, to build, and we'll build it with you so it meets your needs. And so we, of course, have to hear from the community as part of that process, because we want to make sure we're meeting their needs and not be, somewhere where it's good, but not what they actually need 100% of the time.
Excellent. So from here, we're going to be focusing on listening, some research, and then potentially, once we identify where the needs are, applying them to the classroom and applying them to resources that can be provided jointly with the educator, the educator groups, et cetera.
Absolutely. And we have lots of great examples out there already. We still know that pediatric care is scary. This is not new. And so how can we enhance what we do with simulation to make it more accessible to practice simulated pediatric care? through mannequins, through standardized patients, through task trainers, through virtual reality, implementing artificial intelligence, things like that. So many great opportunities, and that's how we can work to meet the needs to, again, put us in a situation where we're going to do great patient care.
Excellent. Where can our followers or listeners go to find out more about simulation in healthcare and specifically to EMS?
We can certainly start with SSH. We have an EMS affinity group, so those of our members who either are in EMS or teach EMS providers, we have an affinity group for that and actually have some EMS-specific resources around that community, and it promotes that conversation and helps us with understanding what the needs are. And so our own organization at ssih.org has the capacity to reach into that group. You don't have to be a member of SSH to be part of the affinity group. We have things like our accreditation standards, our certification examination blueprints for the educator and the operations specialist. All those are standards that can be downloaded, same as the Code of Ethics, the dictionary, etc. INACSL, the International Nursing Association for Clinical and Simulation Learning, has those healthcare simulation standards of best practice that you can go to and download from their website. ASPE, Association of SP Educators, has their standards available for download as well. And you can go to each of these organizations, and they all have a lot of incredible resources. Make sure that you are working with those who understand those resources once you've downloaded them, because it's a lot of information. Because just like anything else in education, it takes practice, understanding of what is published out there, and working with your network, all your colleagues who have already used it, to learn from them and enhance your own practice as an educator, so you do a great job with it.
So just to rehash your website, ssih.org, it would be a great place to go to. And as the National Registry gets more resources and more information, we too will put stuff on our website, and I'm
Absolutely.
sure NEMC will as well.
Yeah, I know NEMC has a lot of resources for educators already posted there specific to simulation as well. I should have mentioned them as a great repository of information as well.
Excellent. Well, thanks for the update. A lot has
course.
happened in a short year, and this will take time,
Yes.
but it's going to significantly add value to the classroom, to the educators, and more to the student, but most importantly, to the patients who will be receiving the care.
Absolutely. And again, as the organizations work together, I think everyone is going to feel how much we are able to accomplish together. I think that's really such an important part of the puzzle, and we're very grateful to be able to do that with you all.
Well, thank you again for joining me, giving an
course.
update, and we'll continue to provide updates as we progress.
Thank you.
Thank you for joining me as well, and as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to NREMT.org. Thank you very much, and again, stay safe.